Hi friends, it's Angel Face Amy, your friendly ostomy nurse, coming to you today with some important advice that I want every ostomy patient to hear. If you've been struggling with sore, irritated, or painful skin around your stoma, this video is for you. Your skin shouldn't hurt, and most common skin problems can be managed or even prevented with the right care. I'll break down the top issues I see in my practice and what you can do to protect your skin and feel comfortable again. So we're going to start with one of the most common problems, peristomal irritation. That means redness or rash on the skin right around your stoma. It's usually caused by contact with stool or urine that leaks out or adhesive pulling on sensitive skin. If your skin is red, inflamed, or itchy, it's important to clean the area gently with warm water. Avoid harsh soaps or scrubbing, which can make it worse. And then pat dry carefully and let your skin air out when you can. Using skin barrier wipes or protective powders can help create a shield between your skin and the pouch adhesive. If you notice the irritation isn't improving in a few days, or if it's getting worse, you're going to want to call your ostomy nurse or your doctor to make sure that it's not something else going on. Another issue I often see is yeast infections around the stoma. Yeast thrives in moist, warm areas, so if your skin is constantly wet or leaking, it's more likely to develop. You might notice itching, redness, or white patches. To prevent this, try to keep your skin as dry as possible and change your appliance regularly. Sometimes your healthcare provider will recommend antifungal creams or powders. You're going to want to make sure you use powders because creams prevent the adhesion of the barrier. Be sure to use those exactly as prescribed. If you feel like you're dealing with a yeast infection often, ask your nurse for advice on ways to reduce moisture and improve your skincare routine. Sometimes you just need to change the barrier or the pouch or use a different product to kind of prevent this. Now let's talk about pressure ulcers, which can happen if your pouching system presses too hard on your skin. This sometimes occurs with belts or convex wafers, especially if they don't fit perfectly or if the skin is sensitive. If you feel pain, soreness, or see open sores around your stoma, don't ignore it. Talk with your nurse or your ostomy nurse about adjusting your supplies or trying a different fit. Pressure ulcers can delay healing and lead to infection, so early action is key. Finally, let's cover skin stripping, which is when your skin peels or looks damaged after removing your pouch. This happens if the adhesive is pulled off too quickly or aggressively. To avoid this, remove your pouch slowly, pressing on your skin, pressing it down with one hand while gently peeling with the other. You can also use adhesive removers or wipes that soften the glue and protect your skin. But if you do this, make sure that you really rinse your skin good with water to get all the residue from the adhesive remover off, because a lot of times that starts a vicious circle of having barriers that don't adhere very good, because those adhesive removers have oil in them and a lot of times they leave a residue on your skin and you don't want that. So if you do use an adhesive remover, make sure you really wash your skin good and let it dry really well before you apply the new barrier. If your skin is fragile or sensitive, talk to your nurse about barrier products or alternative adhesives that might be gentler on your skin. Taking care of your skin is one of the most important things that you can do for your comfort and health as an ostomy patient. If you have persistent skin problems, don't wait to get help. Your wound, ostomy, and continence nurse or healthcare provider is here to support you. Thanks so much for watching. If you found this video helpful, please hit the like, subscribe for more ostomy care tips, and leave your questions or experiences in the comments. I love hearing from you. Stay kind to your skin and to yourself. I'll see you next time.